All right, we're live. It is, if you'll notice that it's just myself and Mike here today. Jay is not with us. I think he's doing adult things and he was tied up. So, hey, everybody, welcome back. This is MI Live. I'm Brad. With me is Dr. Mike Stair. Mike is a regular guest with us. I think he comes on bi-monthly, something like that.
Yeah. It seems like the pattern's been every other Wednesday.
Yeah, I think so. So for those of you who don't know Mike, he's a fellowship-trained physical therapist, physical therapy educator, personal trainer, and nutritionist in the Boston area. You are also the owner of Orthopedics Plus Physical Therapy and Spectrum Fitness Consulting. Is that
That's
correct?
Correct. You got it.
Any other things we need to throw on the byline?
No, but perhaps maybe a point of clarification. You said Jay was doing some adult things. I don't know if he started a new career, perhaps.
Yeah, like he was either adulting or doing adult activities. I don't know.
Yeah. I'm gonna hope that it's the former because keep this thing clean, right?
I'm knowing Jay, we never know. So I'll throw him under the bus while he's not there.
Yes.
So cool. We have a great show today. I'm excited about some of these topics. Some of them I plead massive ignorance on because I just have never really done the due diligence to investigate it and probably don't have the background to actually answer these questions. So today we're really going to try to cover two topics. One is, do standing desks really help? And what does stretching actually do? So I think we'll dive into the first question. I used a standing desk for years. I currently at my home don't have one. But yeah, I think there's probably a couple areas where we can dive into, and I guess from we probably have different backgrounds and perspectives on those. So I think one of them is kind of the posture, orthopedic aspects of it, and then others are maybe around like the kind of cardiometabolic effects too. So I mean, let's start with kind of the orthopedic things and kind of chat about standing desks. Are there benefits? Are there drawbacks? What do we need to know?
Yeah, there's that's pretty much how I mostly got introduced to the idea. Standing desk ranges from what you mentioned, from the metabolic effects from it. There have been some interesting studies that have gotten a lot of people very interested in standing desks, because there was one, we can get into this later, showing that there's a correlation with increased risk of death correlated with sitting.
Mm-hmm.
But where most of my patients and most of my experience has been investigating is using it as a strategy to prevent and treat low back pain.
Okay.
And as you can imagine, I think the first topic is that I get asked about the most is, I have back problems. I think they're related to sitting so naturally. I want to stand more. So unfortunately, as most things, it's not so much about how do I prevent my back issue. It's more like, I have a back issue now.
Yeah.
How do I fix it? So looking at getting a stand-up desk for the purpose of fixing back pain, the way I address it is that, first of all, on the evidence, there have been interventional studies done where they've taken people that have had history of back pain or active back pain and put them in environments where they use standing desks. And what the studies showed is that when people have access to a stand-up desk, they sit less frequently. So let's say you take a bunch of workers, you put them in an environment where they have access to a standing desk. Naturally, they tend to use it more and thus sit less. Then the question is, does that actually help them with back pain? Some studies said yes. One interesting study said no, it actually increased their back pain. And I think that's pretty interesting, because that is what I've seen quite a bit. The logic is that I sit a lot, I have a lot of back pain. When I sit more, my back hurts more. So by extension, sitting is bad, standing is good. And as you know, probably, as many things, the extreme is usually off. The one study that looked at people standing, they had them standing. They're pretty much sedentary workers that would sit, and then they switched them to standing for greater than 2 hours at a time. So logically, that would probably not feel good for a lot of people.
Yeah.
Right. you're used to sitting most of the time, and then you transition to standing uninterrupted for 2 hours. But when they've looked at other studies where people used it ad lib, they would stand, they would sit, they would stand. They actually had much, much better results. So based on the evidence and my experience personally having back issues and certainly treating patients from a wide variety of conditions, it shows that stand to sit desk are actually better. So the ones that can raise up so you can work standing, and then they can lower down so you can work sitting. Very few studies have shown that prolonged sitting or prolonged standing is effective. So based on what I've seen, and some of the literature is not very good at showing the dosage, but from personal experience with patients, I've seen that when people spend about of each hour, 20 minutes of the hour sitting, standing, and then the remainder sitting, they tend to do better. I want to get into one exception though to that. And here's where I think there's some problems with the topic, is that we're considering low back pain as a universal issue, right? So if you have low back pain, and it's particularly worse when you bend over to, put your socks and shoes on, if you're doing any lift that involves you lifting off the floor, and you're younger, that usually behaves much differently, for example, than a 70-year-old who has known stenosis, and every time they walk, their legs get heavy and weak, but when they sit, they feel much better.
Yeah.
That's a big delineator that I think we need to also appreciate. There are different types of back problems, so different types might respond beautifully to standing. When I had my disc issues, I could stand for hours and be perfectly fine. Just sitting long enough to have dinner was enough to trigger my back issue. So there are going to be extremes at either end, and it's not because of some random issue. It's usually because there's different types of back issues that will be more or less vulnerable to sitting.
So that brings up several kind of just questions. And one is, one of the things I'm maybe hearing is just prolonged static postures, regardless of whether you're sitting or standing, maybe appears to be a little more problematic than the actual posture you're in.
100%. And that is the message that I probably have to work hardest to communicate, because it's, I think people are preconditioned to thinking that there's got to be a perfect chair. What chair do you recommend is one of the most common questions I get, and I tell them I don't spend all the money on a chair. Get in and out of a chair frequently. Now, the reason I have no problems making that strong assessment, not only is because we see the benefit of that, and there's good physiological rationale for that. The movement actually helps facilitate nutrient exchange into tissues. It prevents nerves from becoming chronically overstimulated or irritated. There's a whole host of benefits of that. But one of the other benefits is for productivity. They found creativity and productivity is actually better in people that are frequently changing their environment, getting up, moving, walking.
Yeah.
So there's benefits to that too. Arthritis at other joints like the knee and the hip the symptoms have shown to be significantly reduced with frequent intermittent movement. So that's 100% the point, Brad, that you brought up, is that that's what we should be encouraging for a whole slew of benefits, not just for managing the pain.
Because I know, at least from my experience, when I had a sit-stand desk, that was what I would do, just because I couldn't stand for hours at a time and work. Like, one, it was uncomfortable, and two, I can't type while I stand. It's just a weird.
Yep.
Like, it's very difficult. So that's interesting. That's kind of how I just would. It was like every 10, 15 minutes, I was just sitting or standing or sitting or standing. So in terms of that, like, what types of people, like, if we had to kind of lump people, like if you were to try to take populations and lump them into categories, what types of people would see a benefit from adopting like a sit to stand desk versus what people probably wouldn't see a benefit?
Yeah, I think everybody would benefit from a sit to stand desk, and that's the main point I want to clarify. Is a lot of people ask, do I advocate for stand up desks? And I'd like to clarify, sit to stand desks are the ones I like. So Anyone that's got a fixed surface that is just for standing, I think universally are going to have problems with that. There may be some exceptions, very fit, smaller people without a history of back issues. So other than that, everybody will do better with the sit-to-stand desk. I think the bigger question is, what's the dosage that people respond to? Usually the heavier you are, the older you are, the more deconditioned you are, and the more symptom patterns that you have that show that you have difficulty with prolonged standing, i.e. long walks are a problem, but if you're at Walmart and holding onto a grocery cart, you feel better. Those are constant symptoms that we see correlating with people that do better with more long-term sitting as opposed to long-term standing. So I like to break it down in an hour. If you're doing an hour of work, you'd probably do better getting up every half hour and just changing your position. Maybe going for just a 2-3 minute walk and then going back to doing work sitting. So that would be the category that would tend to maybe do a little bit of work while they're standing, so taking phone calls, reading while they're standing, but the rest of the time they sit. So out of an hour, they're getting up 2, maybe 3 times for brief periods of time, but the majority of time is going to be sitting. When we're talking about younger folks that have disc-based issues, which, and I hate to use that term, but that's something that many people identify with. It feels worse when they bend forward. They're relatively fit or active, meaning that they can tolerate prolonged periods of standing. There are folks that will probably do better doing maybe 20-30 minutes of work while they're standing, 20-30 minutes of work at most when they're sitting. So their ratio is going to be more even, if not slightly greater standing versus sitting, but still very intermittent over a course of an hour.
And then the other question I would have on that is obviously prevention and like treatment or, solving an established back problem are two very different things, right? Is preventing, a problem and correcting a problem are very different. So from your read of the literature and kind of your experience working with patients, are sit-to-stand desks, do you think they're more beneficial for prevention or kind of either treatment or therapeutic effects for people with established back pain?
I think they are probably more beneficial for acute treatment.
Okay.
So if you, and you're going to notice that pretty quickly, if you are actively dealing with a problem, you're going to notice the benefits of that pretty quickly. There are loose associations, as you know, and with all your familiarity with nutrition research. Such types of studies are incredibly difficult to perform and have vastly different outcomes. One of the biggest problems with the literature and making that clear assessment, do they prevent problems or are they better at treating, is how people measure sitting time. They vastly differ. Some use accelerometers, some studies use just recall, just surveys. So I think that's why it's a little bit murky. However, there does seem to be some literature out there that does show an increased correlation. That being said, those people who sit longer also tend to be sedentary in leisure, also tend to be less active in leisure. So it's hard to dissociate, is it really the sitting or is it really the inactivity? Surprisingly, there's better research showing correlations with longevity and death and prolonged sitting. So I don't know if you want to get into that whole thing, but that's actually pretty interesting.
Yeah, definitely. Let's jump into that. And one comment just before we move on to that is you brought up something very interesting, and this is one of the things that is very apparent in the nutrition science literature as well, and it relates to most nutrition epidemiology studies that I don't think a lot of people really grasp, is behavior patterns cluster. Right. And so, like, for example, if you look at a lot of the studies, like not too long ago, a diet soda study came out. It was like people who drank, 4 more diet sodas a day had increased risks of all these things. But those people also tended to have type 2 diabetes, were more likely to be obese, were more likely to smoke, were more likely to be sedentary, etc. So when you, those behavior patterns cluster. So that's a really big observation that I think a lot of people will tie one of their behaviors to an outcome and not associate the whole gamut of what their lifestyle is and how those individual pieces accumulate for risk. So there is a big, rich literature base on like sitting versus not sitting and mortality and longevity. And I think one of the very first papers that I believe started to kind of address this was the London bus study back, I think, in the 1950s, where they looked at conductors on the train or the buses versus the drivers. And they started to look at all-cause mortality and showed that. So, yeah, kind of what's your thoughts on that whole aspect of the literature?
Yeah, that's interesting that bus study. I haven't heard of that, so I think that would be pretty cool to check out.
Yeah, I'll send it to you. It's like a very old classic paper.
Cool. Yeah. What really triggered my thought in this is that I was actually researching at what we were talking about earlier is the interventional nature of changing people's sitting postures and to what extent that help my patients with back pain. I was surprised that I found more evidence, more recent evidence, I should say, on its correlation with death. In fact, there were headlines that were coming up saying that sitting is the new smoking. I don't know if you remember seeing those.
Yeah.
And where that was sparked was from, I believe it was the Annals of Internal Medicine, 2017. And what they found was the longer people sat, the greater their risk of death. In fact, if people sat, I believe, cumulatively for more than 13 hours a day, so that's not just at work, but also at home, there was a 200% increased risk of premature death. And what really sparked the headlines was the idea that if people were active and they sat for that long period of time, it didn't matter. That it seemed like no matter how active you were, there was still that increased risk. So I looked into that a little bit more, and what they found was that there seemed to be the greater risk wasn't so much only the cumulative nature. Once it got below, I think, 12 hours, the risk really was affected by the intervals of sitting. So, for example, if you sat in bouts longer than 90 minutes at a time, that was where the real risk was. And if you limited your bouts of sitting to less than 30 minutes at a time, you actually had a protective risk or protective effect. It was like 55% less risk. And then when they looked at activity levels, if you sat less than 12 hours a day and were active, those risk of death went away. And some other studies since have found the same thing. It seems to be based on what I found there was another meta-analysis in systematic review, I think about a year or two later. And it seems that the common finding is it's the interval of sitting that's the bigger issue. As long as you're not sitting for like very, very long periods of time cumulatively throughout the day, activity does counteract that effect. But if you are sitting for prolonged periods of time, let's say greater than 13 hours a day, activity doesn't have that negative effect. So that's pretty interesting as far as some of that evidence. If you want, for show notes, I did a pretty lengthy article that summarized that, plus the other topic we were talking about. So I can link that as well.
Yeah, that would be fantastic. I'm sure everybody would love that. It'd be really interesting just to kind of hear your nuanced thoughts on that topic. So,
yeah.
So, and if you kind of had to summarize what you think some of the mechanisms going on there are, what would you guess?
Well, I think it's probably the behavioral factors that you're talking about before. The fact that people who tend to sit for a prolonged period of time also tend to be less aware of other beneficial health behaviors. So I don't know if it's as much of a direct mechanism of sitting alone. The metabolic effects, I think, are pretty significant. When they showed that people who stood more, they only, I think it was 50% more than people who were sat. They only burned an extra 57 calories a day. So it's hard to argue that there's a metabolic effect that's really significant. For example, when they contrasted that to people who did, I think it was 3 15-minute walks a day, that like tripled the amount of calorie burn as prolonged standing did. So it's hard to say that. I wonder if there's a blood pressure stress correlation with this as well. As we know, that's one of the biggest risk factors for premature death and a correlation with a whole host of other issues. Activity in and of itself is an independent risk factor, regardless of blood pressure and weight. That's a huge factor that I don't think a lot of people appreciate. People think of activity as the mechanism by which you lower blood pressure and you reduce weight. And those things are all true. But there's something about inactivity independent of obesity and independent of blood pressure. So I think it would just be speculative to see what those are. So I'm not sure what all those mechanisms are. I do have a suspicion that orthopedic problems are worse with sedentary behaviors. We see arthritis is significantly increased by those who are sedentary. We see that tendon pathology is increased by people who are sedentary. Spontaneous activity and movement is significantly, obviously less. Those factors make people less capable of doing their normal day-to-day functions. When they're less capable, they're less likely to engage in those spontaneously. And then they're more likely to experience painful, degenerative issues. So a whole sequelae of things could happen from that. And I think a really interesting thing to think of is the attentional aspect. You know, when you're sitting, and I don't know about you, but if I'm working on an article or doing some research, I could look up and all of a sudden, like, there's no lights on in my house except for my desk. Like, it's dark outside. You know, I just got lost, and it had been 4 hours. And I'm like, what the heck just happened? Like, I just went into the zone of stuff. And I think artists do that a lot. I think creative people do that a lot. You know, nerds that like us that like to research stuff do that. And, you know, I don't think that's necessarily a healthy behavior, you know? So
I think my wife would agree with that one.
yeah. So that being said, like one of the main reasons why I try to encourage people, like, maybe it'll help your back, maybe it'll help you live longer, maybe it'll help you lose weight, all this stuff, but it will help your productivity. And there's some really good evidence on that, which is ironic because I think I'm being more productive by being hyper focused and stuff. But when I look back at my performance, I realize it wanes pretty significantly if I don't get up and move.
Yeah, it is very interesting, especially in like the cardiovascular literature around what prolonged sitting does, in especially kind of the atherosclerosis piece of it. You know, there are mechanisms around, like, when you don't have changes in posture, when you're not activating vascular pumps, you know, all those sorts of things can change the actual like endothelial lining of your cells. So there's some very interesting stuff that's come out of the, like, hey, the longer you sit, the more you just kind of build up these pathological responses.
Yeah, as you bring that up, that reminds me of another mechanism. You know, the vascular distension and the pressure changes and the pump aspect of the cardiovascular system. I used to work with a lot of spinal cord injury patients, and we would have to fight with insurance companies about get them in these stand-up tables.
Yeah.
And of course, these people had no chance of being able to ambulate or walk again. But we thought there would be mechanical virtues to getting their tissues loaded, because they could break a leg, not know it, and have all these horrible health consequences, and all of a sudden realize they had a broken leg. Loading those tissues could help. But we found that where the evidence really helped us the most was in stimulating the vasculature aspects of getting their body upright and standing. So that's an extreme example, but it's not too extreme if we consider those who are less active and they're sitting for long periods of time.
Yeah, it's super interesting, especially when we just think about all the different things that are involved in the human body that contribute to that. We do have a couple questions on this. We have a couple questions in general, but there's a couple related to this topic we'll jump into before we dive into stretching. Lovisa, she asked, why are so many naturopaths and chiropractors saying that lower back pain is caused by a weak core and that strengthening up your core is the solution to less back pain? And I know we've talked about this maybe a little bit on previous shows, but where do you think that kind of myth or idea comes from? And, what percentage of the population do you think low back pain can actually be attributed to kind of a weak core, so to speak?
Yeah, that's an awesome question. So the first part, why do people say that? Because it's an easy sell.
Yeah.
Um, when a clinician is asked to help somebody, um, it's much easier to give them what they are expecting and what they want. The alignment between a clinician and the patient is very important. And when both are in alignment, it makes a low friction environment that satisfies both people. It's very difficult when a patient comes in and says, "I'm out of alignment and I need my spine put back into place, and my core is really weak." And you're telling them, "I can't put a spine back into place. If I could, I would be able to paralyze you, and that's not good." And in fact, your core is plenty strong. It's your habits in your day-to-day life, your ergonomics, and your motor control that's off. They're going to look over, glazed at you, and say, "What the heck are you talking about? I'm going to go see somebody else." So it's a difficult conversation, I think, because that expectation is out there. You can actively address something if it's just weak. I'm just weak. So that means I can work hard. And when I can work hard, I can fix this and I can overcome that. I strongly, strongly push people to get strong for 1,000 reasons. That is pretty much my major thrust of what I do. But I also don't want to oversimplify something, because here's what ends up happening. Here's the people I see. I see people that have been to such practitioners that you mentioned in your question, that have tried that and it didn't get better. The prevalence of back pain is a perfect example that we can't just get people strong and fix everything. Believe me, I would love that. It would be far better for business. It would be much easier to do my job. So I think, be honest, that's the number one reason why. We have what I call a mesodermal focused approach in orthopedics. Everything is about a muscle or a bone. But although those are valid key components, it's not a majority of the time the problem. And the reason why I can say, so getting into your second part of your question, why or what percentage of people is that truly the problem with? I would probably say maybe 20%. There are people that are simply deconditioned and they're attempting to do things that are beyond their abilities. And when there's a mismatch, there's always going to be a problem. I would use that, though, only in the definition that core does not mean the abdominal muscles.
Yeah.
It means, the upper body, the lower body, the hips, the whole gamut. So a relatively smaller percentage. A far greater percentage is the other multiple variables, usually ergonomics, habits, poor motor control, cumulative stress that is not attributed to just one simple factor.
Yeah, and the other, in addition to kind of the weak core muscles, I think the other, and this is maybe just my own personal experience, the other thing that gets played or kind of blamed is inactive glutes. I remember I struggled with pretty bad but intermittent low back pain that would come and go for probably, I don't know, 7 or 8 years, and every physical therapist and chiropractor I went to, it was just like, hey, you got to do a ton of band work and activate your glutes, and do single leg squats. And I mean, I did more band work than probably any reasonable person should, and it never got any better. And then over time, it just eventually went away. And I'd say like my glutes and quads are probably weaker now than they were 5 years ago. But the back pain's essentially gone. So That's one of those other things. It's just an interesting thing that's just been decided. That's probably the other cause.
Well, and it's a good observation, and it stinks to have to go through it as a patient to learn it. But a simple thing, though, just the challenge if that notion is still hard to digest for people who have been told, all your issues are due to weakness and everything can be solved by getting stronger, then that would be a really, really easy correlation to find.
Yeah.
Weightlifters, power lifters, highly active people, they wouldn't have back pain. Back pain would be all clustered around people who had poor, stability, strength, performance, and we certainly do not see that pattern by any means.
Yeah. So cool. Well, let's jump on to the next topic because we've got some time to jump into that, and we also have a bunch of questions on this one. So the topic is, what does stretching actually do? So I guess maybe just to break that down into separate pieces. I mean, obviously that's a pretty large question. But when we think about stretching, at least in my mind, I think about really three major components to stretching. There's kind of the actual muscle belly piece that gets stretched. There's the tendons that are attached to it, and then there's kind of the nervous system aspect to it. I think there's you probably also have some thoughts on the fascia component, but kind of there's all those compartments that go into stretching, and I would imagine they're all affected differently. So kind of when we think about the canonical view of stretching, what's actually occurring and what are the actual benefits?
Yeah, and you really framed that really well. To add to that is joint mobility too, the articulation of the bony surfaces and the connective tissues beyond the contractile tissues, the morphology of the joint, the stiffness of the capsule of the joint, the cartilage, and that ability to deform too. And the reason I bring that up first is that might be the biggest differentiator as to why one person can move better than another. Genetically, there is a huge difference in the type of cartilage that we have from one person to the other, and to the shape of joints. An example would be those with Ehlers-Danlos syndrome. Those are super hypermobile people whose thumbs can bend back to touch their forearm. They hyperextend their elbows. They're the contortionist gymnasts or so. So a lot of that is a genetic factor too to throw in there.
Okay. Yeah, so I guess selfishly I'll ask this question because I don't know this before we move on. When you say there's kind of genetic differences between people with cartilage, what kind of differences, like in terms of amounts or tissue quality or different, structures, or kind of what are those differences?
I think the difference is the type of the cartilage, and there's a lot of different subtypes. Some of them inherently are much more stiff, and other types of the cartilage are much more fibrous and robust. And I think that, from what I know about it, by only seeing the extremes of pathology, that seems to be the biggest difference. I'm not sure if it's the amount, but from seeing pathology, it seems to be it's the type of cartilage, whether they have the stronger, more fibrous cartilage or the more lax, loose cartilage.
I did not know that. I just assumed we all had very similar cartilage.
Yeah, it explains a lot, and the reason why I think this is important, and this whole discussion is important, I have found myself, certainly selfishly, but more so in my patients, the more they understand the why, the mechanism, like it makes a lot more sense. I've had people beating the crap out of themselves. I had this one guy who was, just completely gave up his whole exercise program to go into only doing yoga because he needed to get more mobility and these more postures. And he kept having these horrible injuries, these labral injuries in his hips, both of his hips. He was trying to put, I always get this mixed up, square peg in a round hole, right? There's certain people that just are not going to be built to do some of these activities.
Yeah.
I'm not built to run marathons. I could train as much as I want, but my cartilage just isn't built to accommodate that, or be a contortionist. So I think that's important because so many people try to push themselves, think if I just work harder, if I just stretch more, I can get all this flexibility, but it doesn't necessarily work that way.
Yeah, I mean that's one of the interesting things. I've had colleagues in their late 50s, early 60s who still run 110 110, 120 miles a week. And I'm like, even at my probably peak physical capacity, if I ran that much, I would have been broken in half. Like my body, either the way I run or the way my bones are built or cartilage or whatever, it was just, my recovery was just from a structural standpoint was so much different. Yeah. So let's dive into the rest of the stretching piece and kind of,
Yeah.
what do people think stretching does versus what does it actually do?
I think people think that when you stretch, you are going to make your muscles longer. And by making muscles longer, you're going to allow your body to get into more positions. You're going to make it more resilient so that you don't damage your tissues when you go into lengthened positions. We've heard this a lot up here in New England with Tom Brady's trainer and pliability and all that. And just for my own health and blood pressure, I'm not going to get into that topic too much, but that drives me nuts. So I think that's what a lot of people think. And if you think about it, it really can't be true.
Yeah.
We can't be lengthening muscles to that extent. Some people think there will be an aesthetic. I'll get longer, leaner muscles from that. Our ability to change the morphology of a muscle via stretching it is actually pretty poor. If that were capable, if I did a lot of tricep stretching, what would happen to my tricep?
Yeah.
It would loop down here,
yeah.
right? And the mechanical advantage would be severely disrupted to the point where I wouldn't be able to move my arm very well. So that's, I think, what many people are thinking. And by that approach, then the logic is, well, I need to push aggressively. I need to do it before exercise, because if I can lengthen my muscles before exercise, then I can use more range of motion, and that's going to be better. So I think that's what a lot of people are thinking. Do you want me to go into what I think in the literature is about what it seems is actually happening?
Absolutely, yes.
So there was a neat study that was done by, I think it is Wepler and Magnuson, like 2003, Physical Therapy magazine and our journal. And they really shed some really interesting light on what we probably are doing with stretching. In essence, what we're probably doing is having more of an effect on the nervous system. We are decreasing the inhibition of a muscle that has stretch reflexes, that once it gets to a certain length, these stretch reflexes are activated to the brain and saying, hey, hold on a minute, slow down. This is getting into territory we're not used to. It may be particularly damaging. Let's restrict this lengthening process. Now, by doing that repeatedly, that parking brake, so to speak, is released because the nervous system has now been attenuated to that. Your tissues have been able to accommodate that lengthening, and therefore the nervous system says, yeah, okay, we can go there. We're fine. That explains the temporal nature of stretching. When people stretch, they get good immediate feedback. Oh, wow, I can move my arm more. I can extend my hip better. But it also explains why it comes right back. Next day, they're stiff again. Dang it, I got to stretch again. And it becomes this back and forth, until if it's done long enough or over time, again, the nervous system adapts. So I think that's what seems to be happening. We don't have any human examples of, outside of people recovering from prolonged immobilization, that we actually make the muscle fibers longer via stretching. Somebody who's been immobilized, we have been able to prove that muscle fibers do shorten if they've been immobilized for long periods of time, and that is reversible. In rats, they have shown that eccentric exercise will lengthen a muscle fiber, but in humans, we don't have those examples. So the evidence is pretty strong, showing that it seems to be more of a neurological phenomenon than a structural phenomenon.
And are those changes more central nervous system or peripheral? Like, I'm thinking, is it like hardwired somewhere in either like spinal cord nerves, motor cortex in the brain, or like Golgi tendon organs and muscle spindle fibers and like some of those more structural things on the periphery?
Yeah, I'm not sure if we know exactly, but I think it does show some pretty interesting examples. For example, when knee joints are manipulated after surgery.
Yeah.
I have a really interesting story on this. One of my patients is a physician. So he, in spite of his best efforts, was stretching and stretching to get his knee to get better range of motion, and he was stuck at 80 degrees. So he goes in to get his knee manipulated, knows the surgeon, yeah, I guess it was a surgeon, got the operative note. It's not an operation. I mean, they knock the person out and they crank on the knee and send them back to me to try to maintain them. When I was pushing on his knee with pretty much all my might, and he was a willing participant, so I was able to push pretty hard, I got him about 80 degrees. When he goes in to get his knee manipulated under anesthesia, before they even do the manipulation, they got him to 110.
Yeah.
How were they able to get him 110 before they even manipulated it? The central nervous system, the peripheral nervous system was shut down because he was unconscious. So that goes to show the magnitude of that. Is it central? Is it, peripheral? You would think that, there would still be a peripheral stretch reflex. I believe, although I have not done this, I believe you can still stimulate a reflex when somebody is unconscious. So if that's the case, it probably seems like it's more central. Another example to the extreme of this are people that have cerebral palsy.
Mm-hmm.
They have tried to manipulate the tendon through, Botox injections, everything. What seems to be the factor that is causing their tone, which is the shortened status of the muscle and the maintenance of that shortened state, is more of a central nervous system phenomenon. They try to manipulate the periphery, but it's the central nervous system that is controlling that descending input. So in short, just working through it as I'm answering the question, I'd probably say more central. I'm not aware of any evidence, though, that conclusively say that it's one more than the other.
And then, obviously operationalizing this to most people, what role does stretching play in kind of the average everyday person? Like what are the benefits? What are the lack of benefits associated with it?
I think the simplest benefit is that it feels good.
Yeah.
And through the same mechanism by which it's working to cause lengthening, it also may help improve the body's capacity to move through greater ranges of motion, not because we're mechanically forcing it. And the reason why I think that distinction is important is that you don't need to be very aggressive with stretching in order for it to work.
Yeah.
So I think when you think of it as a neurological phenomenon, that's why knowing that the dosage of it needs to be done frequently, but it doesn't need to be done intensely or punitively as if you're going to rip a muscle and lengthen those fibers. So that's why I think that distinction matters. So the benefits of that for the same mechanism as neurological, it could also from a sensory standpoint. So not only allowing releasing the parking brake to allow better ranges of movement chronically, not only acutely. But I think on a sensory standpoint, it's very similar to what we talked about, I think, the last time, the gate theory of pain. When you have multiple afferents, some of which are good, positive afferents, it feels good. That can help the central mechanism by which we process pain favorably. So in essence, by giving it repeated exposures to a sensation that feels good, can actually decrease the output of pain. So I think that is good. I think confidence, seeing visually that your arm can extend further now. I see this especially in rehab, is another good benefit of that. Changing positions, getting back to our prior conversation, it's just a good way to relieve stress oftentimes. That is a common mechanism I hear from therapists, psychologists, that just can help cause relaxation. We know that it's also one of its negatives. Doing a lot of stretching prior to a vigorous lift or an explosive movement is shown to decrease performance. On the contrary, if you want to relax more, if you want to get that nervous, hypertensive activity that you get from working in your computer for 4 hours without moving, we can cause some relaxation in that way too. So there's plenty of good reasons to stretch.
Yeah. The other question I would have too is, we kind of hear, stretching may reduce your risk of like stretching before running or playing some sport or something like that may reduce your risk of injury. Is there any truth to that?
No, there is some evidence that it might increase your risk of injury. I'm not sure the studies were done well enough to make that firm conclusion, but there are studies showing a correlation. Um, when they get a little bit more robust in trying to look at the possible mechanisms, it seems that that is only the case with relatively ballistic activity and in which stretching was done for a prolonged period of time, so longer than 2 minutes, and it was done relatively soon before the ballistic activity, so within 20 minutes. Um, I have not seen on my last review any evidence showing that if you stretch more than 20 minutes before activity, and the duration of stretches are what normal people would do, 30, 60 seconds, that actually cause any risk. So that being said, there's not any convincing literature that stretching reduces the risk of injury either, whether it be acutely or chronically. There is some evidence showing that dynamic stretching, so a stretch in which you're moving your limb actively through a full range of motion without statically holding the position, can improve performance and reduce risk of injury. Um, Again, just like most things like that, you need a little bit more robust studies. Um, which is good. I tell people, hey, if it feels good, you like it, it's part of your routine, do it, but don't do it right before a sprint. Give yourself maybe for good measure 20, 30 minutes before if that's something you really want to do. If it's something you don't really want to do, I don't have any strong evidence to say that it's going to be helpful if you do it. We have some good evidence doing some dynamic mobility stuff within 20, 30 minutes prior to activity. So that wouldn't be a bad idea if you want to check off all the boxes and ways to improve performance.
We've got a couple questions that people have. Some of these I'm just going to try to sort through. So one question kind of boils down to, it seems that it may not be necessary to do daily static or dynamic stretching if you're already an active person and can exercise normally. Is that the truth?
Yeah, I think if you were an active person that routinely goes through full ranges of motion with exercise, there's no reason to. I always use this as an example. How many finger stretches have you done in the last week? How many elbow stretches have you done in the last week? Okay, now
Very
show me how your fingers move. Show me how your elbows move. Like,
yeah.
if that was the case, that we all have to be stretching all the time, then since we hadn't done finger stretches and elbow stretches, we wouldn't be able to move our hands and our elbows. I always say that if you're doing a good routine, you really shouldn't need to be doing a lot of stretching. That being said, you and I, it's like nutrition. Should you supplement? Well, if you're eating a good diet, you shouldn't have any holes in it. But if you really just don't like greens and stuff, maybe it's a good idea to. So if you don't like doing or aren't able to do deep squats or full lunges or deadlifts, maybe you do need to spend some extra time. Or if you have spent a prolonged period of time sitting without doing any exercise for 3 years, stretching is probably going to be more important for you. So I think your general assertion is actually correct. Whether it applies to everybody's situation, there's definitely going to be individual differences.
Yeah, and one of the things that I've just always thought about is like my dogs the only stretching they ever do is like when they wake up in the morning and they do the like downward dog stretch and that's it. Like they're not laying around the rest of the day like trying to touch their toes or anything like that. Or that they'll just kind of do the yawn stretch, but other than that, like animals don't stretch.
Yeah.
I think humans are the only ones that like stretch for the intention of stretching.
Right.
Yeah, it's interesting. So somebody asked, Zipporah asked, can anyone train/stretch enough to do a full split?
I am pretty sure I am proof to the negative on that. Uh,
have you spent years trying to do it?
well, I have three daughters in ballet,
Okay.
and I have, and they have, I believe, inherited my Scottish hips of deep hip sockets, and they have tried everything they can since they were tiny little babies, and they're far closer than I am to it. But they have friends that have done dance for 3 months and they can plop down to a split.
Yeah.
That's what I was referring to earlier. There are definitely congenital factors that will allow that to happen. You can certainly increase mobility of anybody. Maybe the exception to a certain extent would be people with severe CP, but other than that, yeah, you can definitely get a lot of mobility. I would not stop trying unless you're at a point where you're starting to get injuries because you're bumping up against the hip socket and you're getting impingement and derangement of your labrum or so. Very few people are getting to that point, though.
Yeah, and that's one of the other, discussion points too. I think is important. So we, for a long time, there's been a big discussion on like what is correct form for things like squatting, deadlifting, benching, like joint positions, and especially things like, squatting, which is really a pretty deep flexion through 3-joint exercise, knee, hip, and ankle. How much individual variation does there need to be on what's considered the proper squat mechanics just based on hip and ankle structure?
A lot.
Yeah.
A lot. I think it might be exaggerated in some circumstances, but there are definitely cases of this. I am a really interesting example of that. I'm only 5'10", and I have a 35-inch inseam, which is about the length of about the normal 6'2" leg. When I squat, I look like I'm pretty much like this. Very, very long femurs, long legs. No mobility, there's no way I'm ever going to be able to have a vertical squat. I see some of these folks doing Olympic lifts, bobbing up and down, and their torso is nearly vertical the entire time. So there's definitely structural issues, not only in the length of the bone, but also in the morphology of the joint. Accordingly, there must be a lot of variability. There's also an issue that I get into a lot with rehabilitation or with physical therapy. And it's a question, do I rehab or do I compensate?
Yeah.
Breaking 2 ankles, having a fused ankle, there's only to some extent I could spend weeks and weeks and perhaps longer to try to increase that mobility from, 5 degrees to, the normal 18 degrees that they need or 20 degrees that they need. Am I going to be able to do that and overcome 20, 30 years of adaptations? Or maybe I have them get a heeled weightlifting shoe or put, a 10-pound weight underneath their heels because they really want to squat and they want to stay more upright, but their ankle just can't bend that much. So I make a call, can I really rehabilitate or should I compensate? So I think that's another example where you just have to see to what extent maybe you can improve it, but is the effort worth the reward? And maybe you should consider some variation in positioning and standards as to what works best for you as opposed to a universal norm.
And is compensation always a bad thing?
No, compensation is great. I mean, that's what training is. It's muscles compensating for the effects of load and gravity. So compensation is great. Where compensation becomes a problem is when it disproportionately loads tissues that either are not amenable to the effects of training to the same extent. For example, disproportionately loading the capsule or ligaments as opposed to the intended muscle, or it just decreases the training stimulant. So it depends on the context. Unfortunately, that's where you have to qualify and answer with a lot of nuance. But by no means is compensation universally bad. And that's a really good point to bring up, Brad, is don't think that's always a problem. Oftentimes it can cause some issues. It just really depends on the context.
Yeah, and how much of it is just kind of, being aware and acknowledging that there's compensation, and with that compensation comes like you have to change the way you approach stuff. It's
Yeah.
like, if you've got certain injuries, or you have, even just different mechanics, like you mentioned, right? Like you have very long limbs. Like my arms I have like the wingspan of like a 6'8" person, right? So that just kind of changes. Like I don't bench press a lot because of how far the range of motion on my shoulder is. So it's like, okay, I just train a little bit differently, knowing those limitations.
The single best thing I've been able to do to help people stay strong and healthy, in spite of major injuries, because that's again the majority of people I see, has being able to know when to compensate and when to push through something. Another great example with me, I have a very, very damaged neck from my old football injury. I tried and tried and tried. I can't bench press. I can decline a house though. Just by going on a little bit of decline, it reduces the shear that most people can tolerate when their head presses against a bench.
Yeah.
Mine, I can't move my neck for 2 weeks and I'm in agony. Tried and tried, mobilize, strengthen, stabilize, and I do that a lot with patients too. Being very dispassionate about the idea that we have to fix everything.
Yeah.
Sometimes realize there's certain structural inherent limitations, or the effort to fix it isn't proportionate to the benefit you're going to get. So maybe you become somebody that low bar squats instead of high bar squats. Maybe you use trap bar instead of the deadlift. Maybe you do decline instead of flat. Having just such a rigid adherence to norms, it really can hurt people. So that's a great point that really should probably be emphasized more.
Yeah, and how much of the these thought processes come from? I think there's been at least some level of this, that there's a culture of like the process of the specific exercise you do is more important than the outcome that you're searching for, right? So like sometimes people want to get stronger. They're like, well, I have to squat to get stronger. It's like, oh, well, I mean, if you want to be a powerlifting squatter, yes, but if you just want to get stronger legs that are more functional, there are other ways we can go about doing this, as long as you prioritize the end rather than the means by which you get there.
Totally, and it's a tough. I get I think a lot of people bash it as like a bro thing, like, oh, you got squats are king, you got to squat, deadlifts, you can't grow without deadlifts. I get that mentality because it's a very motivating, simplistic. Like a lot of people are afraid of those lifts. They're afraid of pushing themselves, so they need somebody to tell them very firmly and simplistically, you got to do this, you got to do that, you got to do this. And that can be very intoxicating, very motivating. But in the same sense, it can blind you to dead ends. And I've seen the outcome of that quite a bit. So while there is virtue to keeping things simple and keeping some key principles in mind, there needs to be a eclectic view as to routes to get there, especially when you're getting outside of a specific sport. When you get outside of powerlifting, the options you have to get strong and healthy are just, it's overwhelming how many options there are. And that's a great thing, because we have so many different body types and so many different individual nuances. The variability in our structures and our function is quite high. So you need to have a commensurate amount of variability in how you train to achieve those outcomes. But while I do understand that mentality, everything's got to be squat, deadlift, whatever, it's not correct, and it can lead to some problems.
Perfect. Well, we are coming up on an hour. Are there any other last minute things that you want to touch on before we let you get back to your day?
No, I think this is fascinating. I think I could probably go on all day about this, but my patient waiting for me wouldn't be too happy about that. But
yeah,
no, this is a lot of fun. I really appreciate the questions and the insights.
Yeah, perfect. Awesome. Well, thanks so much for jumping on with us. I know everybody here is very appreciative, including myself. It's nice to be able to pick your brain.
Sure.
I just kind of treat it like free consult time with with Dr. Mike. So really appreciate your time, and we'll probably chat with you in a week or two here. So
It sounds great, Brett.
all right. Take care.
All right. See you guys.
All right. Cheers.